Welcome back, little helpers. Today we have a topic that is so overdue. I kind of can't believe we haven't brought it up yet, but I'm kind of also glad we didn't because we have a guest here today that is much more knowledgeable on this than I think we are, and that is Dr. Erin Berenz. She is an associate professor of psychology at the University of Illinois, Chicago, and co-founder and chief clinical officer of Rebound Health. And she is here to talk with us about sexual trauma. So, Erin, welcome. Thank you for coming to school us today. And can you just tell us a little bit about your expertise for this topic?
Yeah, thanks so much for having me. I'm excited to be here. It's an amazing podcast. Yeah, so I actually have for ages been a professor of psychology at the University of Illinois, Chicago, and my whole career has really been focused on understanding why do some people struggle after trauma and others don't. And a lot of my work has been among survivors of sexual assault. And so I've done a lot of trying to do a lot of education about getting good treatments out there, figure out how can we get them into more people's hands, and ultimately realize that stepping away from academia was the best way to do that, and co-founded Rebound Health with Reva Kumar, who is herself a survivor of assault. And we made a trauma recovery app called Rebound, available now in the Apple App Store. You can try it for free if you're interested. But really kind of taking all of the years of research and education that I've had and trying to put it more into people's hands so they can, have the best shot of recovery after going through something like this.
What?
Awesome.
You have a big impact stepping away from academia.
I know, so weird. I thought people might read my scientific journal articles, but probably like my 5 best nerd friends. Yeah. Not the most engaging outlet.
Erin, what is sexual trauma? I mean, or sexual assault? Because
I feel like this is going to open a discussion about how the nuances of sexual trauma are what cause half the problems.
Right, because even just trying to define it or think about what it is, it's like so many people have had unwanted sexual experiences or negative ones or ones that made them uncomfortable. And how do you know when something is like a capital T trauma and might lead to trauma symptoms versus like a bad experience? That's a hard thing to say. What is sexual trauma or sexual assault?
Because there are just awkward sexual experiences.
Yeah.
And what we're talking about here is something a little bit different. But I think, even with this being an area focused on for years and years now, like I come across stories that are in this like murky area. And so I think, it really is kind of a tricky subject. Broadly, I think of sexual assault as any kind of non-consensual sexual activity. And so it's not just penetration, but any, unwanted touching, kissing, grabbing, anything of a sexual nature would kind of fall into this category. But there definitely are, a lot of tricky lines that it's just hard to draw.
Well, yeah, I mean, I think like having a discussion around this makes a lot of sense. One thing that has been really interesting as a cultural development lately, especially with the Me Too movement, has been kind of illuminating how ambivalent consent can sometimes be and feel, and how that can really confuse women and men about like, is this a consensual experience or was that assault? I know I've certainly been in multiple situations like that. And how, women are often people pleasing and don't feel like they can say no, or they feel an immense amount of pressure to say yes. And so then it can feel murky whether they consented or not.
Yeah.
So I don't know if you're thinking about examples like that or.
Absolutely. Like I definitely think, in general, like best case scenario, consent is not a passive process. It is an actively sought thing. And so if you are in a situation with somebody, I think best practice would be not just to get consent at the beginning and certainly not to take silence as an indicator of consent, but just to frequently check in and make sure that what's happening is something that both people want. And I think that the reality is that's really hard to do in practice because people feel uncomfortable or not quite assertive enough or like people pleasing, like you're saying. So I think like in practice, it's really, really hard to do that. But like, I think the gold standard should be like both partners really checking in with each other and, not assuming that consent at the beginning is consent every step of the way. Consent is not like a one and done kind of thing. But, I think that is really tricky. Yeah, I did have some thoughts about this. Like, so the part of it is like you can consent to, let's say, kissing and touching or something like that. That doesn't mean that like if somebody's into it to one activity, they're gonna like kind of be into taking things further. But it can also mean like maybe you've started having sex with somebody and partway through they decide that they're not okay with it anymore. Like it can change moment by moment. And so many women I talk to have like had this happen where they consent to like some degree of sexual activity, but then no longer consent to what's happening. And that, that can fall under assault, like where consent is sort of taken away and the person doesn't listen, doesn't hear them.
Yeah.
That to me would qualify as assault. Yeah, it's tricky. I think this is kind of a classic one. I think in 2024, more people are aware of this idea that like, sexual assault isn't something just perpetrated by a stranger. I think this is one of the most common kind of confusing things that comes up with assault too, is that if you're assaulted, chances are it's by somebody that you know and trust. And you can know that statistically, but then when it happens to you, it just like completely throws you off. So I think that we're past the point of like the stranger in the bushes being like the person that we think is going to assault us. But it's really like probably even more than people realize. It's like 80 to 90% of assaults are perpetrated by someone that you know. So you can rest assured that you're like less safe with people you know well, which is kind of a scary thing. And you can know that statistic, but then if it happens to you, like your brain it's like this mismatch in your brain. Like your brain has trouble connecting the dots that this person that you know and trust, like did this horrible thing to you. And there's this like, thing we think of as like cognitive dissonance. Like one of these, like this, either the belief, like some belief has to shift here for this to make sense. And the easier thing, I think, for most women in particular is to think, that must not have happened to me. This must have been my fault, my failing, like my lack of communicating. This wasn't assault. This couldn't be assault because they wouldn't do that to me. This happens really commonly with women in college, where we've got like something like 20% of college women will experience at least one sexual assault during those few years. So there was this story that obviously not going to give away details of who this is, but a story that I had heard from a young woman a handful of years ago who was at a party with a group of her friends. There was a male friend that she kind of, knew and trusted. They weren't even dating or anything like that. He ended up sort of seeing that she was intoxicated, had her go up to a bedroom. Came up with like some excuse to get her to like go away in private with him, locked the door, took her phone away from her, was treating it like a game, sort of holding it over her head, put it out of her reach, and ended up sexually assaulting her. And she felt so confused as to like, well, how did I let him get me in that room? Like, how did this happen? Like, I must have done something wrong. This was somebody I know. This is a friend. And really was struggling to kind of make sense of what happened. And, not only because she knew the guy, but also because there was alcohol involved, which is another sort of frequent confusing thing that happens.
Oof. Take us through then what tends to happen after that. So like, do you see some common like steps that happen or things that happen to the person? Like they start to blame it on themselves and kind of like shift their thinking there. But then what? Are they in shock after? Do they like what happens?
I mean, definitely, in a lot of cases in college, like sometimes it's even just piecing together what happened. Like if somebody had been drinking and had been like targeted by a perpetrator because they were drinking, like that's a whole other layer we can get into if you want. But if you think about like you're more likely to know somebody who assaulted you, then also I think the part we don't always consider is that your social support network is likely to also know your perpetrator. Mm-hmm. And then, thinking about the environment in college, like, social networks in college, I would say the large majority of college women in particular who I meet have maybe never told anyone what happened to them. They don't disclose to friends. They don't want to make their friends choose sides. If they do disclose, sometimes they lose a lot of friends in the process. And that can be incredibly shaming and isolating too. So I would say a classic way that this looks in that age group in particular is that they, start to withdraw, don't want to come in contact with the perpetrator. And sometimes that means not seeing their other friends too. Also, it makes it hard to, go to class, do your studies because you might run into that person on campus. I think, I'm bringing up college just because it's such this like bubble that like your whole world is like kind of shaken up. So, you're kind of like left with this like emotional aftermath while the perpetrator is just out living his life, doing his thing, hanging out with your friends. There's a lot of shame, a lot of guilt, a lot of just feeling sort of, broken. And for a lot of people, I think their whole life course can kind of shift after something like that happens.
This has to be one of the most confusing traumas for so many reasons. There's the ambivalence about consent that can happen. There's the fact that this can be one of the only like traumas that's pleasurable. And, if it's pleasurable, what does that mean? Does that mean you enjoyed it? Does it mean you wanted it? Does that, I had an experience where I passed out drunk in a bed with a friend and her boyfriend. And I like woke up to him touching me, but like it was pleasurable. I didn't stop it fast enough. And so then it was like, I was like felt a lot of guilt about that. And like I had betrayed my friend and still very confusing.
Yeah.
And like multiple experiences of saying explicitly, I do not want to have sex tonight. And then them being like, okay. And then 10 seconds later pushing into me. And then half the time you've been like, okay, well, I guess we're doing this now, so I'll enjoy it. And so then it's like, how do I categorize that?
Yeah.
And so, yeah. And so kind of, but not feeling like that was an attack. And so how do I wrap my head around it?
Yeah.
Always kind of looking for like, what was my part in it? And it's weird being a psychologist and knowing how I would approach it as a therapist, but not feeling that way.
Oh yeah. We are much more clear-headed with other people's experiences than our own. That's for sure. Yeah. I'm really sorry that happened. And it's like so common. And I'm really glad that you brought it up because I think that's like a layer that a lot of clients even, like aren't comfortable bringing up. And I'll have to like often like sort of probe for that or sort of look for it. And the way I approach it with like clients, especially, is thinking about like the difference, like what is sexual arousal? What is pleasure? Like there are, a couple components, like there's the physical piece of it. And then there's like mentally how we're thinking about it and viewing it. And those aren't always on the same page. And so I have definitely talked to many women who experienced like physical arousal at some point during an assault, even to the point of orgasm, for a completely non-consensual and sometimes like violent or rough encounter. And that can be so confusing, and I think a lot of women end up feeling kind of betrayed by their body when that happens too, because their brain might be screaming like, I don't want this, like in the more extreme cases. And then while their body is physically responding, like that can happen. And so I try to do a lot of educating around the difference in those. So like your body responding is not the same as you consenting, and it's not even the same as you enjoying it in the way that you would ideally enjoy a sexual encounter. And so I think that's a big thing. I think the harder question is like that gray area, like you're saying, is like you kind of these situations where you're like, I actively am saying I don't want this. It's happening anyway. And so I just, I might as well give in. Like, I don't know you feel free to tell me too. Like, I wonder if that's partly your brain trying to say like, this isn't, let me make this so it's not assault. Let's make this like so that it fits a little more neatly. Or I'm feeling like I have some agency I'm getting back. I don't think it means necessarily that you wanted it to happen, but.
Well, I think what made it very difficult for me for a long time was being raised with beliefs like if I have sex with a man too soon, he won't call. I'll devalue myself in his eyes, in society's eyes, whatever. Like every time you have sex with somebody new, you lose in a way, like you lose some degree of power. And so me, maybe in a situation where I otherwise would have wanted to have sex, I have all of this running in my head of like, I can't feel comfortable with this because I know that will regret it, or like I know that I'll lose something essential here. And
Mhm.
so me saying like I don't want to have sex, that wasn't my body saying it, it was all these narratives saying it.
Mm.
And then him just completely disregarding that was really went along with that narrative, like, oh, you're right, like as soon as I'm in a sexual experience with you, you devalue me, and so that's what's happening even further. And so, okay, like, yeah, I guess we're doing this now, like I've already lost, so I might
Yeah.
as well like not put up a fight, or not make this unpleasant. And
Yeah.
it's an experience where like the act itself isn't horrifying. It is with certain sexual assault, obviously, but like these situations, it wasn't horrifying. It's not like I was being hurt. Like physically, it's not like I was terrified. It's this kind of like, oh, okay, I guess that's how little I mean. Well, I guess
Yeah.
I'll have to deal with that tomorrow,
Yeah.
and that makes it kind of confusing. Like, is that really traumatic, or is that something I can just sort of deal with cognitively and let go? Or
Yeah.
is this just a kind of confirmation of my narrative? Like, what is this exactly?
Yeah, I think you're highlighting like a big issue in our society, which is women being put in the position of being these like moral gatekeepers of sex, and being in the position of like in the first place having our self-worth, our morality, our attractiveness as a long-term partner like wrapped up in this like kind of virginal narrative. Whereas men are just kind of able to do as they please, try to get as far as you can, that classic like more is more. You and he would have been like kind of raised in very different ways in terms of how to think about that scenario. Him like trying to get as far as he can,
Hmm.
and you, oh, it's my job to like be the one to regulate this. And if I fail, it says something about me, not about him, not about the interaction, but about me. And it gets just really kind of messed up.
Speaking about that control piece, which is like, it's interesting because control in trauma is such a big thing. And like,
Mhm.
what can you do? What could you have done to control and stop what happened? And what can I
Yeah.
do to control and stop it happening again? I remember, people who have been through that, they do wonder, like, oh, I should have not gotten drunk that night. I should have not gone with that person. I should have not, right? And it's
Hmm.
hard to argue because it's like, yeah, those things were all choices, right? And how do you navigate talking to patients or survivors of sexual assault
Yeah.
about that question of like, what could I have done to stop it?
Well, I think there's like, I mean, it's like, that's a huge question, a really good question. I think there's a few kind of angles that I think about this. One is that in a lot of ways, when something traumatic happens to us, whether it's a sexual assault or some other kind of trauma, we are not really in control of our bodies. There's this very kind of like, what's the word I'm thinking of? Like caveman style,
Fight or
having way
flight?
finding. Yeah, there's this like fight, flight, freeze kind of thing that happens that's just like evolutionarily derived. Like when you're in danger or when you're in a traumatic situation, you're not like calculating, here's what I'm going to do. Your archaic part of your brain is taking over to try to keep you alive and keep you safe. And so I think I see the most guilt when people have this kind of freeze response. In extreme cases, people feel like they literally cannot move. But we aren't choosing how our brain responds. And most people's natural response, especially women, is not to fight. Like that is not kind of the go-to that most people experience. But there is this like intense physiological fear response that happens. It's designed to keep us safe. And sometimes it's not the right thing in that situation, but like we didn't choose it. It's not something we have control over. I think on the drinking front, like that's a huge one, like drinking or using other substances and then being assaulted. The tendency is to blame the woman. Like I think about like that Brock Turner case at Stanford, like, a handful of years ago at this point, where, he was a star swimmer. He was drunk. This young woman was drunk, and he sexually assaulted her behind a dumpster when she was blacked out. And there was a lot of debate around, was this her fault?
That's nice.
Oh, it's real nice. Yeah. And there was a whole trial, like trying to pick apart like her drinking behavior, like how much is she to blame? It's not his fault, all this stuff. So I think there's a lot out in society that perpetuates that kind of thing too. But there's actually some really interesting research that's been conducted among young adult male perpetrators of sexual assault. And somehow these researchers got these guys to like get really candid about how do you go about this? Like, how do you choose like who you're going to assault? And so, I don't know how they did it, but these men were just like opening up, telling everything.
Oh, I
And the
have to
kinds
read
of stuff.
this.
Oh my gosh, I'll find it and send it to you. It's kind of a more qualitative study, pretty small sample, but really, I think really eye-opening. But there are men just kind of explicitly saying, yeah, if I see a woman who's drinking, I will try to get her to drink more. I will look for someone who's drunk because I know they'll put up less of a fight. And so it's, this isn't guesswork. Like, men who are doing these things are saying, like, they are choosing the person who they think is in the most vulnerable position. And so why should it be our job to not be vulnerable instead of their job to like not be predators? It makes no sense.
So they weren't showing any kind of, like, these were like people who were actively doing it. Were they in prison? They weren't showing any kind of remorse.
I'll have to find the study, so don't hold me to
Okay.
this. 99% sure these were men in college reporting
Oh my God.
sexually assaulting women.
I can't be, I will let you jump in a second.
Sure.
I just like can't. It is just the height of entitlement to just think like,
Yeah.
I'm horny, so I think I'm going to abuse another person. I think that's what I deserve to do. Like, I think I deserve to put my penis in them. That's
Yeah.
what I'm going to do. It doesn't matter what they think or feel. Like, that's what I need to
Yeah.
feel better. And I think maybe a lot of women can't even conceive of that kind of entitlement. So it
Yeah.
just doesn't compute.
Yeah.
I don't know. Kibby, sorry. I knew you were trying to jump in.
No, I mean, it's along those questions, like who tends to be perpetrators of sexual assault? It must be, as you were saying, like if you are sexually assaulted by someone you trust and know, then your brain has to do some jumping jacks around, like, is this normal behavior? Is this my fault? Are they a bad person? And if they were a bad person, how did I not see it until now? Right. So is there any, or is it like it's just what guys do, quote quote? Like is it something about nature, nurture, who tends to sexually assault? Is there no way of
Yeah.
telling?
Yeah, and I want to be real careful here because this is definitely not my area of expertise, but so I'll try to like stick to the things that I do feel more confident about. I don't mean to like focus only on college study. It's just where so much of this research has been done because it's this like discrete period of time where this stuff is happening like at crazy proportions. But it does tend to be a small number of men who perpetrate multiple times. So it's not this thing that like, oh, this is what all men do. Most men do not sexually assault women. Another explanation I hear frequently is that, oh, it's because they were traumatized, they were abused themselves. That must be why they're doing it. But the research does not support that. In fact, if you look at trauma exposure in childhood as a risk factor for things in adulthood, like in the vast majority of people who have been through assault or trauma themselves are not perpetrating against other people. So that explanation doesn't hold up. My hunch would be that the reason a lot of perpetrators of violence have violent histories themselves is probably because there is a piece of this that like runs in families, right? Like if you inherit some amount of this like tendency towards this sort of like behavior that's unacceptable, you're probably around people in your family growing up who also have those traits or are more likely to have those traits. I'll keep it that broad because I'm not really so up to speed on the literature there to like jump in a whole lot further, but yeah.
Yeah, I think so at first, the Me Too movement, I was like seeing a lot of the excesses because I hate cancel culture, but then I think it did so much good. And my favorite story from the Me Too movement was the Aziz Ansari one because it was really nuanced and I think pointed out a lot of the cultural factors that led to what happened. So it wasn't this just cut and dry. I mean, obviously we needed to know about Harvey Weinstein, his, demonic behavior, but I really appreciated how the Aziz Ansari story showed a lot of different factors. Like Aziz was clearly going for the not no, not the enthusiastic yes. And it seemed like in many ways he was doing the things that men I had gone out with were doing, which was just like, all right, I'll wine and dine her and set her up in a situation where then she's entitled to give me like I'm entitled to get sex from her. Like
Yeah.
that's
Like very
that she's obligated.
transactional. Yeah.
Very transactional. Yeah. And then like, okay, I'm going to demonstrate my masculinity by doing things that are actually uncomfortable for her and that she's not into, but will make me feel like more of a man, like putting my fingers down her throat or whatever.
Yeah.
And kind of constantly backing away when she says no, but then with the intention to come right back in again and see if I can right this ship for my benefit.
Yeah.
And clearly him not thinking he's done anything wrong, because I guess that's just the setup for men on dates. Like maybe that's just what they thought. And it's kind of amazing when I think about like that attitude.
Yeah. It's super unrelatable with the way society brings us up.
Well,
Yeah.
right. And then you can
Yeah.
see that on her side where she's just like, wow, I was really excited to go on this date. And the more things slip sideways, the more I want to fix that dissonance. And okay, I'll just keep going and see if it gets better and like see if I can position it for my benefit. Like maybe this is
Mhm.
romantic. Maybe there is an actual connection here. Oh, no. Okay. Well, maybe if I wait a little bit longer. Okay. Well, now I'm in a situation I don't like, but I don't know how to speak up and I keep trying and it doesn't really work.
Yeah.
So,
Well, and the power
uh,
differential would have been there,
right.
male celebrity, lots of money.
Mm-hmm.
Anytime there's that like power difference, that ability to say no it's just harder and harder.
Yeah.
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 What do you see are the typical trauma symptoms from sexual assault? And if anything is different from like other kinds of trauma or ones that are like
Yeah.
common.
I'd say like across the board, as opposed to like different types of symptoms, like the most notable thing is that the symptoms are just much more severe after sexual assault compared to other types of trauma. So I think the biggest takeaway is not that like, oh, it's so different, but your likelihood of having trauma symptoms like PTSD after a sexual assault is just so much greater than other kinds of trauma.
Interesting.
So there are studies published, for example, showing that, and this study I'm referencing was published by some researchers at the VA, actually, showing that women civilians are more likely to have PTSD than male veterans. And a lot of the reason for that is because we're more at risk for these really high severity traumas like sexual assault. And so there was this other, I'm just going to go full nerd on you. There was this other recent meta-analysis of what's the likelihood of developing PTSD after sexual assault. So meta-analysis for people who are not like steeped in nerdery like I am and you both are, is like, like kind of combining a bunch of studies so that we can be like even more sure of the results. So if we can like get more people and more findings together, we can be more confident. And this study was conducted by Emily Dworkin, a friend and amazing trauma researcher, and some of her colleagues. And they found that 75% of people who experience sexual assault will meet criteria for PTSD 1 month after the assault. And at 1 year after the assault, 42% will meet criteria for PTSD. Even me being a trauma researcher, again, who's like been around for a while, I just like still felt shocked by that. And so I think that's the biggest thing is like the need is out there. Like if people know someone who's been through this kind of experience, especially recently, like chances are they really need support and help. I think that's a big, big takeaway. Don't assume that people just kind of get over sexual assault quickly. In terms of specific symptoms, this is kind of more my clinical judgment here, but I think some of the biggest stuff, which isn't surprising, is just like a change in sexual behavior and interest. So if you're sexually assaulted, any kind of sexual contact can like trigger your trauma memory and can make it really hard to have like a healthy relationship with somebody. So, it's not just feeling afraid at sexual contact, but maybe like disgusted or just, a range of emotions can come up. And so that, can just make it hard to like have normal relationships, like go on, get married, have kids, do all that whole thing, talking about pregnancy and childbirth after sexual assault. That's a whole other topic. But there also can be sometimes an increase in sexual behavior, which I think can be confusing to some people. So, if any of your listeners have experienced that, like, no, that's incredibly normal too. And so a lot of times that's like kind of an indicator of like your relationship to your body just changes after assault. So maybe you don't feel like you're in control of your body. Again, if you were somebody who had like physical arousal during an assault, maybe you feel like your body betrayed you. but there could just become this real disconnect between like brain and body in that domain. Sometimes you just feel like completely unempowered to set sexual boundaries. Maybe your brain has learned this is what men want from me. This is what people want from me. If this is all they want from me, let me use this as a tool. Let me at least get something that I want out of this. There are so many ways this can look. So what I'm saying isn't like kind of, the same thing for everybody. So I think if your interest in sex goes way down or your engagement in sex goes way up, either of those can be really normal after sexual assault.
Like, this is so sad. I mean, it's just so common that it's just like, I thought being like a women in your 20s was all about, but what can we do about it? Like, how good
Yeah.
are the treatments out there? How difficult is it to find? How
Yeah.
effective are they?
So I feel like I, have been a bit of a downer on the show so far with like, here's all the bad stuff. Like the good news is
That was
there are.
unavoidable.
Yeah, that was, I mean, the topic of the show. We're only going to be real about it. But the good news is that there are treatments out there that work. And I feel the need to say that all the time, because I think there's a huge myth out there, just in popular media, that trauma recovery isn't a thing, or it's a lifelong process, or you can't actually get better, especially if you've had like repeated traumas. And thankfully, that's not true. There are good treatments that, if somebody has PTSD, they go through one of these therapies. For 80 to 85% of them, they won't have PTSD once they get through the treatment. So stick with it, find a treatment that works. All of the treatments that have these kind of results are forms of cognitive behavioral therapy. So looking at changing thoughts and feelings and behaviors around trauma. And these kind of fall into two camps. One is really focusing more on looking at how like your beliefs and your perception of yourself in the world have changed after trauma, finding like what are your stuck points, the things you're hung up on that you just like your brain's struggling to move past because of your assault. The main one's called cognitive processing therapy. It can be really hard to find providers that do these treatments. I think that's the biggest struggle, but thankfully there are like emerging some like self-help versions of these. So there's a cognitive processing therapy self-help workbook that's available on Amazon. I can send you guys the link to it.
Yeah.
It's published by like the best of the best who do this kind of therapy, and it's really wonderful. The other camp of this therapy is more focused on processing your traumatic memories. And so it's a really emotional thing to go through this kind of therapy, because you have to activate those memories to kind of move through them, to make sense of them. And you're basically retraining your brain to feel safe when you think about what happened to you. So there are a few therapies that take this approach. I think EMDR is the one that most people have heard of. Prolonged exposure therapy is another. And there's research showing that, if you're not able to find a therapist who does this, there are self-guided versions of this that you can do on your own. And so Rebound, the app that we made, is taking this approach, helping you on your own through an app, learn about trauma, learn about your brain and body and how it's changed, get your brain out of emergency mode by processing what happened to you. And so I can definitely like share links to both of those things. And also there are a couple really great resources I like to share with people too. One is through the American Psychological Association. They have a little overview of like the best supported treatments for PTSD. The VA has great resources online, even for non-veterans, understanding trauma and PTSD and treatment a little bit better. So I think those are really great like educational tools as well.
Amazing. I did want to just ask quickly, because I feel like we've had a big focus on women who have been assaulted.
Yeah.
Do you know, are there differences in the experience between men and women who have been assaulted?
I'm not aware of major differences. I know it can be, I know that men who have been through this kind of experience often feel really isolated and alone, because I think it's just, there's even more stigma speaking up. For a lot of men, they've experienced a sexual assault in childhood would be more common than in adulthood. Whereas for women, it tends to be, unfortunately, kind of both, like along the lifespan. And certainly, men or any members of the LGBTQ community are more likely to experience assault than their cisgender hetero peers. So, definitely these are very real phenomena. I focus on women a lot of the time because it's just the numbers. It's overwhelmingly women. It's overwhelmingly, sexual and gender minorities. But certainly like any, there are men out there who have in adulthood been sexually assaulted by women. It just happens less often.
Well, and men who, or especially when they were children, were assaulted by other men, which I think would be extremely complicated to wrap your head around.
Oh,
Because there's the
absolutely.
aspect of sexuality and
I think the worst story that I heard along those lines was someone I had spoken to through one of our research studies who did identify as a gay man, but was sexually abused by someone who had claimed to be like a sort of a mentor advisor to him as he was in the process of coming out during adolescence. And so, thinking about the breach in trust and just like the abuse of like power and vulnerability in that situation, I think of that not infrequently, just how horrific that is.
What can you give us a snapshot of what treatment would look like either through like Rebound or a therapist? Because I can imagine a lot of people with trauma symptoms are afraid to delve into those things and think maybe if I talk about it or think about it, it's going to make me worse, right? Which is like
Yeah.
a whole part of the trouble, right?
Yeah, I think that's what a big myth is. And there are definitely providers out there who think I can't ask people about their trauma because I will make them worse. The reality is anyone who's having an emotional response to being asked about their trauma, they're already thinking about it every day. They're already having their brain taken over, flooded with these memories. You're not creating that or causing it to happen. I want more people to feel comfortable talking to patients about trauma, not fewer people. And there actually have been studies showing that the level of distress people feel when they're asked about their trauma is very short term. So even if you get a spike in anxiety or negative symptoms, it's short lived and it will go away on its own. There are no data to support that like talking about or thinking about your trauma in a therapeutic safe setting causes you to have a emotional crisis or breakdown or anything like that. And so that I think is really an important context to consider here. I think the decision to work with a therapist around one of these treatments versus something like Rebound is like super personal. We definitely have a lot of members on our Rebound platform who do both. Like maybe they have a therapist to get weekly support, but then they like the structure of the app to guide them through sort of the treatment for processing their memory. But I think some of the things to consider when making that choice would be like, do I feel ready to tell another person about what happened, or do I need to work through this kind of in a little more privacy first? There are also some people who maybe had bad experiences with therapy and they want to work through it in a different way. And I can, appreciate and respect that too. On the other hand, there might be people who are like, feel so dysregulated when they think about what happened that they couldn't imagine going through like processing that memory without the support of a therapist. Or maybe somebody who, is trying to maintain sobriety and worries about like relapse if they were to try to do this on their own. I think my biggest advice to people is just like trust your gut about like what you need and where you're at, and to try your best to be the one in control of your journey. Like what you need better than me or you or anyone else. In terms of what it looks like, at least the processing of the memory, I can tell you a little bit about how we approach it in Rebound, which is how I went about it in my clinical practice, which I didn't make up. This is sort of based on decades of clinical research and the privilege of getting great training in this stuff. But it's really educating people around like, what is trauma? What is PTSD? What are the normal reactions to trauma? Some of the stuff we were talking about earlier in the conversation, like what tends to happen to people, like how they see the world and how they feel day to day, and what happens in relationships. So giving a lot of education too around how do our brains change? How is our PTSD maintained by the way we react to trauma triggers and trauma memories? And why is it important to process the memory? Again, to kind of get your brain retrained to feel safe, feel calm, make sense of what happened, so you can kind of put it behind you. And so what we do is we guide people through talking through their memory bit by bit. We start really simple, just sum it up in 4 sentences and say those out loud a few times. While they're speaking, we have something called a story bubble that is just kind of gentle. It's like this orb that gently pulses as they're speaking and pauses when they're quiet. And so we instruct people to kind of focus their attention on this orb to kind of stay grounded in the present, and to kind of see how long to keep going until the exercise is over. So we start really simple, and then each time they do a storytelling session, they're asked to give a little more depth or a little more focus on a certain area, like what kind of went through your mind, what did you feel in your body, and sort of like by the end of their journey, they're giving this very detailed, very comprehensive, like emotionally rich story about what happened to them during their traumatic experience. And they're also kind of processing like, what goes through your mind, like these different, reactions or thoughts you have about yourself, processing some of the meaning behind what happened through little quizzes and exercises as they go. So it's really designed to like ease you in. And this is kind of how it would be in person in therapy too, ideally, is like starting with something manageable and building from there until you're able to kind of like put the past in the past.
One of the questions that I get most stumped on when people reach out to me on Instagram, for instance, or friends get in touch is like, how do I find the right therapist? And this is an area where I would think that would be particularly important. So do you
Yeah.
have any tips on like, if you're just starting, if you've been assaulted and you're noticing that you're really struggling, like where do you go? What's your first step? And how do you find that person?
That is such a tough question. And so, depending on like kind of where you live, what your financial resources are, your insurance, it's so tricky. So I think, kind of thinking like layers, like first and foremost, you have to find somebody you feel like safe and comfortable with, that you can afford. Beyond that, like if you have the financial ability or the access to like choices in therapists, which not everyone has, if you are fortunate and you have these resources to be choosy or picky, I would say to ask around a little bit. So, dig into some of those, some of that information on good treatments that like the APA or the VA offers, so that you have a little education of what to ask for. So supportive counseling is great. Like we all want to be listened to and validated and heard, but that next level, if you actually want to work through your symptoms, you have to be doing sort of one of these proven treatments, I would say, as like your first try. So again, those will work for 80 to 85% of people. So like if I'm thinking about it, like I want the thing that I've got the best chance to get better. So you could literally call a therapist up, send them an email and say like, hey, before I come in for an intake or like kind of share about my personal experience, I just want to make sure that you're like in a position to like give me the help I need. Like, do you do cognitive processing therapy? Do you do exposure? Do you do EMDR? How do you approach that? What does it look like? And just try to get a sense that they are describing what you understand that treatment to look like based on that reading. That is way more work than I want any person to have to do who's in that position. But I think that the reality is that's kind of what our system looks like right now.
Yeah,
If you're
it
really
sucks.
lucky, you've got like a great, like really tuned in, like primary care physician or something like that. But it's hard for them to know everything about all of these.
I know it's a big frustration for therapists as well, being like, how do we?
Yeah.
Because and not all therapists are created equal, and not all therapists have the same training and
Yeah.
level, like degree of training. And so it's always frustrating when I meet people who are struggling to find a good therapist or don't know how to find a good therapist, don't know what to ask for. So thank you for
Yeah.
that.
Well, it's
And
hard. And like, I do these treatments, but that doesn't mean I'm the right therapist for everybody. Like
mhm.
there are people out there who we don't, maybe they don't click. Maybe I'm not the right fit for some other reason. And that's okay too. So, I think at the end of the day, like I can give you all the guidance possible about like, these are the best treatments, but like each person kind of has to do what they feel is right too.
Yeah.
Yeah.
Well, the kind of the last area that I wanted to talk to you about is what friends and family can do, when their loved one has been assaulted. And again, recognizing the complexity in this, like I interviewed a woman who had been assaulted by her brother and cousin, and they were there every single Christmas, and it's like her family wasn't willing to disengage with her assaulters because they were their own kid or nephew.
Yeah.
And sometimes people are very motivated to not blame the assaulter. And just, it just seems like there's so much complexity with this. And the
Yeah.
fact that people lose friends and are told not to report and all, it's a rat's nest. So I just
Yeah.
wondered if you could help us untangle.
It is so true. And I've talked to so many people in that position where, it is a family member, a friend, and it's like some twisted version of a divorce where like people are divvied up, have to choose
Mhm.
sides, and not everyone chooses to support the survivor. And that's a challenge. So like I'm gonna approach this assuming that whoever's hearing it wants to do the right supportive thing for someone. So if somebody that is disclosing to you, telling you that they were assaulted, I think the most important thing to do is to listen to them. Don't try to jump in and fix it. Tell them what they should do. Don't make it about you, and your emotions that you're feeling. So I think, first and foremost, kind of check your own emotions, and you can definitely set aside time to like deal with them and process like your emotional reaction later, but in that moment keep your emotions in check. So it may be that you have a memory of your own that gets triggered, or you may be reacting because you know the perpetrator, or it's a member of your family or friend circle. But just hold back judgment, take the approach that what they're saying happened, assume that it happened, let them sort of share at their own pace. You don't have to push for a lot of detail. It's okay to sit in a little silence, but give them space to share as much as they want to, and definitely validate any feelings that come up. Let them know that you hear them. I think it also can go a long way to like thank them for opening up to you, because it's a really, really hard thing to do. A lot of people don't do that. Thank you so much for trusting me to tell me this. Like, I'm here for you. And you mentioned reporting. I think, it's definitely a personal choice, but I think a lot of people's tendency is to push, well, we better call the police right now. And there's a whole laundry list of reasons why that's not the right thing for everyone. Not least of which is the stats on the small number of people who actually get persecuted, and the process can be, for some people equally traumatizing as the assault itself to go through the reporting process. But just, no judgment about what they should do from there. Really just listen to them, let them know you're there for them, and try to do everything you can to give them the control and the agency they didn't have during the assault. So instead of saying, well, we better call the police right now, what would you like for us to do about this? How do you want to handle this right now? Trying to put them back into the driver's seat, so to speak.
Tricky question about that. What if you have a partner who has been sexually assaulted, and I mean, I guess it's the same thing with any kind of loved one, but
Yeah.
how do I say this? It could be tough because it's like you also aren't getting your needs met sometimes in that. Like if someone is shut down or someone is triggered, or you also have you like when you're saying like hold your emotions, like you
Yeah.
also have to hold back your needs sometimes and look lopsided in those relationships. So what do you do if you have a partner with sexual assault and you're kind of like walking on eggshells about that?
Yeah, that is really tricky. And it can lead to a lot of tough feelings for the partner who was not assaulted, especially if if just their presence, or certain experiences, or sexual contact, if that can serve to trigger their partner. You can end up feeling like you're being treated like a perpetrator, even though that's not how maybe you've been interacting in the relationship. So if that's the case, yeah, it can be really, really tough. I think trying to have open lines of communication about like what's emotionally going on with the person, trying to be really patient, listening to them, hearing them, understanding what are they going through in the moment. I think couples counseling can be really helpful too, from a therapist who has experience working with trauma. The cool thing too is that there's some research for approaches, doing some of this like CBT for PTSD symptoms that incorporate a partner or loved one. And so it may be like, hey, let's, I know this is something that's going to take some time, but are you open to working through this in therapy, like I'm happy to be there by your side as you work through it. May help them like understand a little bit more too about why is their partner responding the way they are in certain situations. I think when it comes to like sort of a sexual relationship, 100% like, being really open about like what each person's sexual boundaries are. Are there certain ways of like touching or interacting that are more likely to trigger you, or to like give you kind of a negative reaction? And if so, like, obviously let's not do that. Let's find other things that are more pleasurable for you. But kind of similar to what we were saying earlier, like kind of keeping the lines of communication open as far as consent goes too. Like if you get triggered, tell me and we'll stop right away. Like a lot of patience, a lot of giving agency and control to the survivor of assault. But then I think, the stuff that's in the non-sexual domain even is like the survivor may experience a lot of like emotional numbness, might dissociate sometimes, might feel like they're kind of far away, like they're not really focusing on what you're saying. Sometimes that can be challenging too. So I think just kind of gently checking in, like, hey, what's going on? Are you having a memory right now? What's happening? There can be issues with trust, all kinds of things. So I think bottom line, trying to have patience, trying to have empathy, validating their feelings, but still like trying to, push to work through it together. Like it doesn't mean that that's sort of what you need to accept in the relationship, because you do have needs too. So not like this is how it will be forever, but how can we work through this together? How can I support you in working through this?
Yeah, I would never compare myself to like a rape survivor or anything like that. But I think with me, it was just like a systematic reduction of trust in men and their intentions, and like how they saw me as a sex object, and had a relationship where I was like heavily guilted into sex all the time. And my current partner is just so helpful in, because I like dissociated a couple times when we had sex, and he was very helpful in just like, okay, the situation ends now. Like you have no guilt. I'm only doing this if it's for both of us. And then letting me be the initiator most of the time, which kind of allowed me to bring in my own agency and like, oh, I'm doing this because I want to, not because I'm obligated or because I'm meeting your needs or something like that.
Yeah.
And I'm not suggesting that is a one size fits all idea, but it was very helpful for me in being like, okay, I'm connecting with my own desire now instead of just saying, I'm a sex object like I always have been. So
well, it sounds like too, I mean, he sounds wonderful, but it sounds like there was a certain level of like conversation you must have had together about those past experiences, like an openness to like get to that place where he knew what's the thing you need.
Yeah, for sure.
Yeah, that must, I mean, that's a brave thing in and of itself to kind of like bring that in. And
yeah, I mean, I've always been pretty open and transparent. It's just like whether I actually believe, like, I told a partner in the past and he would very much make it about himself and be like so angry that other men had done those things to me, but yet he was too. And it seemed more like he was upset that other men had touched me. And so it was like, once again, I'm being devalued for this having happened. But yeah, Jason's I see these boyfriends in my patients sometimes, or I call them like therapy support boyfriends or therapy support animals, where they just like they make my job as therapist so much easier, because I know that my patient has somebody who's there and like does the interventions with them and is a point of trust. And that's what I have for myself. So very great.
Yeah, that's perfect. Yeah, it makes a huge difference.
Yeah, it does. All right. Well, so grateful that you came on and talked with us about this. It's definitely an episode I wanted to do for a long time, and I'm really excited to go get really specialized training next year at the VA so that I can be more helpful to patients in this way. But just wanted to thank you for coming on and discussing this. And also, when we were talking about how hard it can find a therapist, it sounds like you've created a tool that's really helpful for that. If you don't have access to somebody who does CPT or prolonged exposure, or even if you do, but that's not the place you want to start, then we have this tool.
Yeah, absolutely. I'm really excited about it. The nice thing too is if people aren't sure, they can try it out for free. It's not an Android yet, but in the Apple Store, it's available now. But this has been such a great conversation for me too. Like I'm the weirdo that could talk about this all day. I do talk about this all day, every day, but I appreciate you guys having me on and having such a thoughtful, like in-depth conversation about it. It made me think about some things I haven't thought through in a while too.
And Rebound, your app is it's so great. It's so easy to use, and it's really like simply laid out. Like everything is just really easy to follow and to understand. And I really love it. So we'll definitely link it to the website, but everyone should check it out.
Nice.
It's definitely a good app.
Yeah, Kibby, you could say that because Kibby was one of our kind early test users who checked it out for us. So
yeah,
you saw it at the most basic it ever will be.
It's great.
Yeah, thank you so much.
Okay, little helper as well. If you enjoyed this conversation, please go on Apple Podcasts or Spotify and give us that 5-star rating and leave a comment. Also, if you have any questions or comments about this episode or any other, please feel free to email us or DM me at Trombolina. And we'll see you in a couple weeks. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.